children and is safe at the level of 0.7 milligrams per liter, which is the amount that Lebanon had been using. The debate went all the way up to the city council, which was also divided.
Every time somebody would send something to the council for us to have as information, it looked like sale brochures.
The town voted, and by less than a 4-point difference, the people of Lebanon voted to remove their fluoride.
I'm a firm believer in giving people their own voice and their own choice in how they focus on their health. Personally, I don't think there's a safe level for any kind of a toxic chemical in my water.
But that view was not fully shared by everyone. Sean Ettinger, a former Navy engineer, voted to keep the fluoride in the water.
If you trust the government, the consensus is clear. If you run in other circles that don't trust the government, that don't trust the CDC, then obviously they're going to throw all that data and science out the window.
We put the question to dentists. Some didn't want to be interviewed because of the divisiveness of the issue, but Dr. Highfound, an ADA member dentist and Oregon State representative, says he can see clearly the difference in his patients' teeth.
I believe in it. It's a safe thing to use.
Another town he works in, Hillsborough, isn't fully fluoridated.
Is there anything that is hurting? So in my Hillsborough office, I do see a higher number of patients that do have cavities. When they do have the cavities are a lot bigger, it's more severe.
And as the debate over water fluoridation spreads to other communities, more towns will have to choose.
Every city's just going to have to decide on their own. Vote your conscience with it. And I would hope that it goes to the people.
At the end of the day, I think people who are anti-fluoride aren't bad people. I just think that a lot of times they've been misinformed on information.
I'm Lana Zach.
A new report finds more Americans are dying of heart disease than any other cause of death. The American Heart Association says that's because risk factors like high blood pressure, obesity, and diabetes continue to rise. CBS News chief medical correspondent Dr. John LaPook stresses that it's important to know your cholesterol numbers.
Specifically, people need to learn there's something called LDL, that's the bad cholesterol, and lipoprotein A. You should know both of those numbers. And then, of course, we all know about high blood pressure, about diabetes, about exercise, about eating right. And then there's family history. You have to choose your parents wisely, right? There's not much you can do about that.
In the U.S., about 350,000 people die of sudden cardiac arrest every year. About half of them had no idea they had heart disease. The FDA is expanding the use of Ozempic for patients with both chronic kidney disease and diabetes. Novo Nordisk, the maker of the medication, says the approval was based on a study showing Ozempic cut the risk of death from chronic kidney disease and major cardiac events by 24%.